So with support from UNFPA, we have formed so many adolescent health clubs, both in the community and in the schools. But the exception that Anto is doing has really touched the heart of UNFPA, and Gladys Ajao, who is the head of the facility, is doing extremely well.
As the sun bathes the Wassa East District in hues of gold, our journey unfolds. In a district boasting a total population of 103,879, among them 24,924 women of fertile age and 18,000 vibrant youth, we delve into the heartbeat of life, focusing keenly on the Anto community.
I'm Gladys Ajao, midwife officer in Anto CHPS zone, Wassa East District, Atobiasu sub-district. I was posted in Wassa East District in the year 2012, worked at Ateku Health Center. Later reposted to Ekuchaso Community CHPS as a community health nurse. In 2019, I was reposted to Anto CHPS, still as a community health nurse, but later furthered my education to be a midwife. It all started in the year 2018, where my district director, Emmanuel Yao Aflekum, and public health nurse, Ms. Sheila Ampedu Ochre, attended a year review in Takrade. After the meeting, informations were disseminated to us that teenage pregnancy rates has increased, so we should find a way of organizing adolescent clubs in our various facilities in schools and then in the community. I took it upon myself to meet the chiefs and then the elders of the community to organize Anto CHPS, Anto Adolescent Club, in the year 2021.
Anto Adolescent Club.
The Wassa East had a significant number of teenage pregnancies, which was as high as 18% from the year 2017. But currently, as we are talking, it runs at a percentage of 10. And this has been as a result of interventions that have been instituted over the period from the national, regional, and also with support from UNFPA in the area of empowering the adolescent age group within the district.
UNFPA's impactful collaborations with local leaders, health experts, and communities foster resilience and transcends boundaries.
UNFPA, as part of its 7-country program, has worked extensively in the Western region. As part of our mandate, UNFPA is out there to ensure that no woman dies while giving birth. But we also ensure, very importantly, that young people and adolescents have the necessary information and skills to make informed choices about their health and well-being. And it is in light of this that our program with the Western Regional Coordinating Council and the Ghana Health Service has focused on ensuring that adolescents and young people are reached with much needed programs that help them to grow and become productive members of society.
So with support from UNFPA, we have formed so many adolescent health clubs, both in the community and in the schools. We have Ekutuase, Atobiase, but the exception that Anto is doing has really touched the heart of UNFPA, and Gladys Ajao, who is the head of the facility, is doing extremely well. She's able to organize these young ones on a weekly basis to engage them, to teach them in all these livelihood skills.
So we started with a number of 60 adolescents, and currently we are about 100 to 120, 87 female and then 25 male. We had issue with the male joining because they felt reluctant in attending the meeting. They also, per our interactions with them, they were like they are shy. They think it's only for ladies and not for them, the guys, so they refused attending the meeting.
My school was at Wassa DHHS. My area school make sure some results beba. But me be Adolescent Club no abua me pan. Me organizer. Ye be meeting, I mean na me bua omo anu ne ye hia. Ye su enyema bebre.
My name is Christabel Logo. I'm 13 years old and I'm a member of the Adolescent Club. Abra I'm joining the Adolescent Club. Me na for I can say so when you get pregnant, it's normal. And now, yeah, Jane say when we get pregnant, it will be normal for us.
As the club was going on, one challenge we had was parents discouraging their children from attending the club. Others too were of the belief that this club is not going to last for a long, because there is nothing good we are giving out to the kids. But we never allowed this challenge to have any impact on us with the nurses.
My name is Henry Tanunu and I'm an enrolled nurse at Anto Zone. Some of the challenges that we encounter here is one, distance. We have so many communities around and we wish that all the adolescents there can partake in the Anto Adolescent Club. But here is the case that some of them, where they are, they have to come by means of transportation and the parents are not willing to support. We also can't get that fund to also bring them on board. So that is one challenge. And also some of the parents too, because of illiteracy, they don't really have a fair idea about what goes on in the club. So that one too is another challenge for us. And also we don't have the required tools for adolescent education. So we wish that we get literatures and stuff on adolescent education that will really help with the teaching and learning of the club.
Coming to the communities, they were also trained to do this bead making, pastries, and even soap making. This has gone a long way to engage these young ones and has reduced our teenage pregnancy in the district.
So currently we have less than 2 adults getting pregnant at a time within the area. The target is bringing it to 0. And we are feverishly working on that.
Our journey to Anto unveiled a harsh reality at the CHPS. Limited equipment and crumbling infrastructure pose formidable barriers to essential healthcare services. Despite these challenges, Anto Health Facilities healthcare professionals strive to provide care in less than ideal conditions.
Growing up was very challenging. 4 siblings and my mom, making 5, who has been taking care of these 5 children. It was very, very challenging. It wasn't easy for my mom, but my mom had to try her best to cater for us, to take care of us, to find for us, and do everything for us to get to where we are today. Seeing these kids in this community, it's like what I've been through when I was young. But I've taken it upon myself just to give them the education, to support them in any way I can, for them to also get to where I am today. It has become a very big challenge, but
talking about Gladys Ajao, who is leading this course, she's really helping the young ones and also their mothers have come to realize that engaging these young ones will go a long way to help reduce teenage pregnancy in the community.
Mrs. Dinah Ologo, Rita Opine. Before Akonya so Adam Wassa Adolescent Club, Amode Yaba, and Prodre Muha. What to me was a sacre, Abba Quadano Afa, or share any message I say, now me crana minim, say why ye menses. And see a china, that's no catch me say, ma, me person me got top part, and Mr. Paddy would the other, no say, ma, starting me menses, so now me say. Now, what about one country and channel, but see, they used to not say, ma, ya call young club no. How much share and sign your menu now, and see me to me, I be beer. Now me catch and say, Mate. And tell me, man, the scout got top part, and say, man, no, men, and I'm not sure. Send your bessy, I know. Or ye be beer, pepe, mistake beer, and my home. It's me to me, was say, sir, a year, club beer, Mudia by your could dream, a boy and Cassan. I don't send any a boy and baby. Yes, see a bit table. I will find me away, Munyashi in Frimo, Mumana Muja, Munyashi in Frimo. Also, yeah, Yamama, and Colano, Amal, Yan Fasube, a woman, Yadamwase.
In Anto in the Western region, the UNFPA program, with funding from Global Affairs Canada, has brought livelihood skills to members of the community, has worked with parents, traditional leaders, health professionals, and more importantly, young people, to ensure that we can affect the lives of these young girls and empower them for responsible adulthood.
I must say that all these activities has actually improved our FP coverage. And even for last year, we were first among all the 14 districts. UNFPA is doing a lot, and since it's an ongoing program, we recommend them to continue so that our young ones can have a better future.
In the spirit of UNFPA's Ghana slogan, for the good of Ghana, the Anto Adolescent Club stands as a beacon of hope.
For the good.
For the good of